Anatomical positions. Today we'll learn about the basic positions used in anatomy and medicine. Anatomical position. In the anatomical position, the person stands upright, facing forward, arms at sides, and palms facing forward. Supine position. In the supine position, the person lies flat on the back, facing upward. Prone position. In the prone position, the person lies flat on the abdomen, facing downward. Lithotomy position. The lithotomy position is used for pelvic or gynecological exams and surgeries. Here, the person lies on the back with hips and knees flexed, and legs supported in stirrups. Fowler's position. The Fowler's position is very important in respiratory and cardiac care. Here, the person sits semi-upright, with the head and chest raised, to improve breathing and comfort. Now you know the anatomical, supine, prone, and lithotomy positions. See you in the next lecture.